All right, hello and welcome everyone. My name is Sarah. I'm with the Center for Survivor Agency and Justice, and while folks continue to trickle in to join us today, I'm going to take you through just a few housekeeping chores so that you feel, excuse me, so you feel comfortable with the tech platform and can engage with our faculty and all of that. So I hope you're having a wonderful Thursday and thanks for joining us. Just a couple of notes before we begin. We are recording this webinar and it will be available on CSAJ's website within a day or two. So check us out early next week if you want to catch some more or some reruns. We are also streaming live. We have limited seating in the house today. So if you have colleagues or others who are not able to get into this room, feel free to share this YouTube streaming link, which I'll chat to everyone here in a minute, and they can watch us online. Also feel free, we're gonna ask you to chat with us to have some discussion. So please, if you hover at the top of your screen, you should see a whole bunch of options for chatting, for Q&A. Pull down the chat button and say hello to us, like I am doing to you all right now. You can also exit out of full screen. When we share our slides, sometimes it goes into full screen, and under view options, you can exit the full screen. You can change if you want to see the presenters in a bigger view or the slides in a bigger view. So don't be shy about playing around with the technology here. And in addition, you had the choice to either choose computer or phone to join us by audio today. If you're having trouble hearing, sometimes switching to your phone setting has a little bit better quality, depending on your bandwidth. Like I said, please give us a hello. Thanks, Jessica, for saying hello. I hope you're having a great day. And if you do have any technical issues, again, my name is Sarah. I'm your host. You can raise your hand. You can chat to everyone. You can also chat to any one of our panelists, or you can chat to me privately, and I'll try to help address your technical issues. The panelists will try to attend to your questions, but also engage with you all today. So with that, again, I want to really welcome you to our webinar today, Race Equity Approaches to Domestic and Sexual Violence, a Research and Community Lawyering Perspective. We're honored to be joined by Lynn Jacobs, CSAJ's own Legal and Policy Director, Camille Holmes, Kip Hawley, and Bill Kennedy. And Lynn will be introducing them later, and they'll have a chance to introduce themselves. So I am going to invite Lynn to start us off, and you should now have control, Lynn.
Excellent. Thank you, Sarah, and welcome to everyone. Thanks so much for joining this second in a series of webinars that we are putting on race equity approaches and issues. As Sarah said, I am Lynn Jacobs. I am the Legal and Policy Director for the Center for Survivor Agency and Justice. We are gonna throw out a few poll questions while we're waiting to get to critical mass and have folks join us. And the first of those is a poll just to let us know where you're from. If you can respond to that, we will throw those responses out there, and then we have a couple of other questions before we move into the substance of the webinar. We're so pleased to have everybody join us this afternoon, or this morning, depending on where you are.
And you should see a poll pop up. If not, go in that toolbar and select polls, and you should be able to vote. If it's, so we'll hang on here for a second. Are folks able to see the poll?
I can, Sarah.
Okay.
If folks are having any technical difficulties, you should just chat, and Sarah will do that voodoo that she does so well.
And if the poll isn't working for you, feel free to just chat to us where you're coming from. Looks like folks might be having a hard time finding the poll, so maybe we could just use the chat function for now. Or we're having a shy Thursday.
Or an eager for Friday.
Exactly.
I see a couple of people have responded that they're from the Midwest. As a woman who is Buckeye born from the state of Ohio, that warms my heart. See some responses from the West Coast, one from Lexington, someone from the Northeast.
DC, all right.
And New Jersey, moving up the East Coast. And then out to San Jose. Welcome. So Sarah, I see the sign says poll in progress. I don't know what that means as a technical matter.
It is in progress, but I'm not sure if folks can see it. We've got 0 votes, although I know we've got folks in the room and they're sharing where they're coming from.
Okay, I see Louisiana. Welcome, folks. We were in the middle of polling folks and having folks chat to let us know where they are from. We're going to move to our next question. By the way, Sarah, you have the comm, so if you could move to the next question, that would be great. Welcome to folks. I see additional folks registering in from Seattle, from Pennsylvania and Colorado, from Ohio and the Northeast. If you could now respond, the second poll is up. It's about what it is that you do, what your role is. If you could pick the best option, or alternatively, if you have called in and so you don't have the screen before you, or if you're having any kinds of technical difficulties, just feel free to chat to us about whether or not you're a DVSA program specialist, an advocate, a court advocate, a government agency work person or manager, a healthcare provider. We're just interested in knowing a little bit about who's joined us.
Still not seeing anything trickle in from the poll, so we might be having some issues. So feel free to use the chat, folks.
Excellent. And thanks, Hannah, for registering, and Jessica. We've got a counselor advocate. We've got somebody who does outreach and training, community outreach, TV specialist, elder rights paralegal, financial ed classes. Excellent. DV coordinators, paralegal at a DV legal services nonprofit. Welcome, welcome. DV attorney. Sexual assault advocate, legal fellow, shelter transitional housing, counselor and advocate. Fabulous. I think we should go on and get started. We've got one more thing for you all to chat to us about as I begin the webinar. And that is about the kind of work that you are doing in the racial equity and domestic and violence sphere. And with that, I'm going to start us off this afternoon. For those of you who have just joined, I'm Lynn Jacobs. I am the Policy and Legal Director for the Center for Survivor Agency and Justice. It is my pleasure to welcome you this afternoon on behalf of the Center and its Executive Director, Erica Sussman. We are first going to start with a little bit of background and context. And then we're going to move to the substance of the webinar this afternoon. The Center for Survivor Agency and Justice is a nonprofit that's about 10 years old. Its mission is to promote advocacy approaches that remove systemic barriers, enhance organizational responses, and improve professional practices to meet the self-defined needs of domestic and sexual violence survivors. Our vision is of a world where all people have equal access to physical safety, economic security, and human dignity. Our work includes a number of initiatives, including the Consumer Rights Initiative, the Accounting for Economic Security Atlas, and this afternoon's webinar comes under the heading of our Racial and Economic Equity Project, or REAP. So the formal name of the REAP program is the Legal Impact for Racial and Economic Equity of Survivors Project. The goal of that project is to increase grantee capacity to address racial and other structural and institutional biases that pose barriers to economic stability for survivors of domestic and sexual violence. The REAP project has a number of different sub-projects, if you will, including our impact sites for racial and economic equity. We are pleased to be partnering with two groups, Enlace Comunitario in New Mexico and Oklahoma City Artists for Justice in Oklahoma City, Oklahoma. In addition to our impact sites, the REAP project is also comprised of an impact assessment and national strategic impact agenda, of a webinar series, of which this is the second, of a legal impact resource library, of a survivor story core, and of technical assistance. The partners on the REAP project include the Women of Color Network, Inc., the Southwest Center for Law and Policy, the Asian Pacific Islander Institute on Gender-Based Violence, Casa de Esperanza, the Texas Council on Family Violence, the Kirwan Institute for the Study of Race and Ethnicity, Camille Holmes, and Bill Kennedy. As I said before, this is the second in a series of webinars. Just a reminder to those of you who joined us for the first, or FYI for those of you who did not. Our first webinar took place at the end of January and was entitled Racial and Economic Equity for Domestic and Sexual Violence Survivors. In the context of that webinar, all of the REAP partners who I just named spoke a little bit about their work, talked about racial equity tools, and particularly our domestic and sexual violence partners talked about the way in which they work on racial equity issues, While we're going to take a deeper dive into racial equity issues today, just a reminder from our original webinar that these are tools that advocates, and likely all of you on the phone, use every day, whether or not it's looking more deeply at health disparities and what the impact of that is for survivors in general, or for survivors of color, or looking at issues around the wage gap and how that might apply differently depending on the ethnicity or the political identity of the survivor community in which you work. So again, welcome to everyone on behalf of the Center for Survivor Agency and Justice. Camille, I'm going to turn it over to you.
Hello, can you hear me? Great. My name is Camille Holmes, and I am a consultant with the Center for Survivor Agency and Justice, as well as working on other consulting projects. But I'm very excited to be with you today and to lead us off into this conversation. This webinar, we sent out objectives beforehand that focused on the 7 identified racial equity tools and how those tools have been used to transform advocacy in other areas, and another set of items there that you can read on the objectives. But what I want to say is that there are so many different ways of approaching this and the tools and concepts are complex. And so I want to adjust your expectations a bit, because at the end of the webinar, you'll have a sense of some of the range of things that this set of experts and practitioners have done. And there is so much more out there and a lot to learn. So I'm hoping to invite you on a journey of, or welcome you to join us along our journey, if you're already on a related path, to better understand and better effectuate advocacy to promote racial justice and racial equity. Good. Just to get us started with values and ground rules, and for those of you who are from maybe a social work background or a community organizing background, you are very familiar with using ground rules. For those of you who are lawyers or maybe from private sector or from a different culture, you may not be as comfortable, or this may not be a part of your culture. But what we want to do is just to say that in the DV context and the sexual assault context, everything is survivor-centered, nothing about us without us, and to recognize we're all learning. We're looking to have a collaborative and cross-disciplinary, cross-movement experience. We recognize that none of us have all the answers, but all of us know something, and that experience is valuable. So we encourage you to say what you know, to build trust in the way that you work, and even on this call. Ask your questions, share information, unearth assumptions and in real time, and we'll work to find ways to connect to each other with respect, and to respect the fact that we're all entering from different places, different levels of understanding, different experiences, different disciplines. Cross-discipline conversation is always and often complicated, because our meanings have been developed in different contexts. So with that, just a few ground rules: try to be present and to share from your own experience. A little bit about honoring context and history in this racial justice work. What we're going to talk about comes out of a lot of context, movements from the anti-lynching and civil rights movements to farm worker movements to all the way up to Black Lives Matter. Leaders like Ida B. Wells or Ella Baker or Cesar Chavez or Alicia Garza. Movement work has been about shifting people's understanding of what's necessary to make change sustainable. And so I want to give a nod to the many movements that inform all the work that people working on racial justice and racial advocacy are doing. Social scientists and legal scholars as well. Critical race theory. And if someone can't hear me very well, thank you. I'm going to try to, we got a note on volume, so I'm going to try to speak up a little higher and let me know if that's better. What I will say is, let me ask for the people in the chat room, how many of you are familiar with critical race theory? I'm going to get a sense of, with our polls, it didn't work very well, but we were trying to get a sense of who's in the room so that we can make sure that we're speaking to all the different players. We have folks who are from the sexual assault community. Some folks are from the legal services. Some folks are from, okay. And so we've got a lot of different groups. Some of you will be hearing things you've heard before. Some of you will be hearing new things. So just, we'll try to meet you where you are and bring what you know. And so what I'm going to do, because the time is running a little short with our beginning, I want to say that as I go through, I'm going to come back, I'm going to mention people who are contributing to the ideas that have been put forth in this webinar, because we are sharing them with you, but we're also borrowing and standing on the shoulders of many different kinds of folks. And we know that many of you out in the field are doing racial justice work, you're doing racial equity work, you're doing gender work, you're doing LGBTQ work, you're doing work with white people against racism, you're doing disability work. All of these traditions have connections that are important, and we're trying to bridge those connections and connect this community to each other and to the resources available. So, question, first this slide said, what is race equity, or what is racial equity? And I changed it to what is equity, because there's some key concepts we need to understand. And you can say that you've heard this before or not as we're going through. It's very helpful to see where you all are in the chat box. So we think of justice, and some people equate that with diversity. And justice is not equal to diversity. Diversity is variety. Justice is also not equality. We want equal treatment under law, and we want justice and equality in the ways that it's written on the Supreme Court building, but equal means sameness. And so when we're talking about equity, we mean fairness, justice, and doing what's necessary to ensure that you get what you need regardless of where you started. How many of you have seen this slide? It's very popular in the communities that I come from. I am a lawyer by profession, but also a trainer and facilitator. And if you haven't seen the slide, oh, got a lot of yeses there. So equality versus equity. Equality is giving everybody the same thing. Equity is giving people what they need depending on how they're situated. Why do we want to focus on equity? Oops. My slides are running away without me. There we go. Why do we want to focus on equity? We want to focus on equity because it's of structural oppression. People don't end up in difficult situations. I mean, in our society, we have this framing of individual responsibility and that everyone can make it on their own, but we all know that we need support in our society. And so not everyone has the same level of support, and many people are experiencing a level of oppression. And when I say oppression and oppression at the structural level, not one person doing something to you, but the society, our history, our culture, our education, advantaging certain groups while disadvantaging other groups, and making that look like the norm. That can often be seen in our isms. You know, there are lots of different ways to oppress people. You can use race, sex, gender, gender identity, sexuality, and so much. So when we think about addressing these isms, we're really trying to develop an anti-oppression framework. And again, this, for some of you, this will be very basic, and for some of you, this will be new. I want to focus on structural racism because race is the oppression that has defined much of how we experience and articulate and effectuate oppression in this society. From the genocide of the Native Americans and the decision that their way of doing things was not civilized, to the enslavement of African peoples and bringing them over, to the banning of Chinese immigrants and Mexican residents, not immigrants because they were here before many of us were. From all of these spaces, the way that we have begun to have, the way that society articulates oppression is based on race and racism and that particular experience in this country. And so let me have a check-in. How much of this is new, old? Give me a little feedback from the field so I can see where you all are. One got an old but good stuff. A new perspective, very interesting. So all over the place. Thanks for the big ups. Great. Okay. So structural racism is racial bias across institutions and society. An example is a racial wealth divide, where if you are a white person and you don't know the other history, you may think, wow, I'm having a really hard time, but you also have an inheritance that you got from cumulative privilege over time that you just may not be aware of. Someone similarly situated may not have the same level of wealth and actually be much less privileged than you would imagine. I think it's a 1 to 5. I need the number, but the level of wealth for 10 to 1. Thank you. Bill is raising his hands. It's a 10 to 1 wealth gap where for Black and brown families as opposed to white families. Racial equity is a situation where you can't predict what likelihood of someone's, you can't predict the likelihood of someone's life outcomes based on who they are and how they're situated. So using a racial equity framework, the importance of that is to move us from a reactive posture to a powerful and proactive power. We want to prevent oppressions. We want to understand how to do that. We want to create equitable communities. We also want to do that around gender, around class, around ability. And so, but to be able to do that, we have to be able to talk about what the real challenges are and not get caught up in the way that race is used to deflect us from doing positive social justice work. The 4 levels of racism, I'm not going to go deeply into them. They are internal, interpersonal, institutional, and structural. Bill and Kip will talk about that a bit later. And so great. I want to introduce my co-panelists who have done a tremendous amount of work in this area. When I was thinking about the history and culture, one of the organizations that has really led the way is the Kirwan Institute for the Study of Race and Ethnicity. John Powell there has been a great path maker and conceptual leader, thought leader, really, in the intersection of race and poverty, and helping people to think about how to be more effective in our advocacy. Kip Hawley is a research associate at the Kirwan Institute, and he does a lot of work with communities, helping them to create tools and strategies to make change when it seems like the odds are stacked against them. Bill Kennedy is a solo practitioner and consultant, but spent the last many years leading the Race Equity Project at Legal Services of Northern California, and has a long legal history before that. He, along with Mona Tao, Zenobia Lai, Fran Fajana, and others in the legal service community were really instrumental in bringing some of the tools, practices, and approaches from some legal scholars, social scientists, folks like the Aspen Institute, into the legal services community. And what was fantastic about that is that the legal services community often thought about poverty and thought of themselves as anti-poverty lawyers, but not as advocacy leaders for racial justice, or as folks who should be thinking about that work as core to understanding how to do their work better. And so because you're on this call, I'm assuming that you all are looking to bring that into your DV experience or expand your experience by building on those other experiences. I'm going to pause for a moment, and I think there's a sound check for Kip that we need to do before we move forward.
Hello, everybody. I apologize for my lateness. There was an emergency sort of leadership meeting here that could not be avoided at the last minute. And so I apologize for interrupting and coming in a bit late.
No,
Can everybody hear me?
we can hear you.
Okay.
Great, and thank you. You're right on time. So to get us started, I wanted to ask Bill and Kip to share a story about how they've used racial equity tools and racial equity concepts and skills to work with the community or in partnership with the community to make some real change. I'm going to ask Bill to go first and turn it over to you.
Hello, everyone. I'm happy to be with you here today. I just wanted to point out that the scenarios that Kip and I are going to speak of are not directly related to the survivor community. This is because we don't presume to understand the culture, the different imperatives that exist in differing communities. We wouldn't know these until we got there and started working. So we're going to give you examples that we think from which you can extract the benefit of those tools. So the story I'm going to begin with is this one, that about 7 years ago, 3 weeks before Christmas, our office was approached by several families from a community in South Sacramento called the Avondale Glen Elder community. They were referred to us by another group with whom we had used the race equity tools, and they thought that they may apply in their community as well. We were told that strangers were coming to the doors, going door to door in this neighborhood, and offering $500 cash and a $200 gasoline credit card if they would sign away the mineral rights to their homes, to the land beneath their homes, to a company called the Sacramento Natural Gas Services. They were unsure what was going on, and they had suspicions that they just couldn't shake. So they said that a majority of the neighbors had already signed away the rights to the mineral rights beneath their homes. So adopting the race equity tools approach, we began to engage in what is called community participatory research, in which we tried to do two things. One is we gathered data. The attorneys and the advocates in our staff gathered data and did profiles of the Sacramento Natural Gas Company. But we also gathered histories, oral histories of the community. And we learned that this was a historic African-American community created by redlining and deed restrictions in Jim Crow times. It was immediately adjacent to the Army Depot, which made it which someone thought linked the advantages of the GI Bill. So it was a segregated community started in the early 60s. It was still 92% people of color. So going through this research project, we tried to do two things. One is lay the groundwork for data, but also come up with a genuine narrative, the narrative that people understood. So we found out, for example, that that the community had already been burdened, already felt that they'd been burdened by dozens of toxic siting. by going, we mapped the area, we showed those things, we helped to create through mapping and framing a response. We had learned that the approvals for this project were already 90% complete. We also learned that SNGS, the gas company, had $14 million they spread around the community, buying off potential allies. We came in very late. The goal was to put race on the table, make sure that this was understood as a racialized action. It was to change the framework from one of process to one of impacts, and to show that areas occupied by white families that had the same sort of geological formations under their homes were passed over. So using the tools of mapping, framing, and using what we call a racial impact statement, which was linking current policy and current approvals to racialized outcomes, and showing how the only fair outcome that wasn't racialized was to stop this project, they were able to defeat that project. So again, just that's a brief description. I think Kip may have a description now.
And yes, Kip, go ahead, and thank you, Bill, for sharing the Avondale story. The challenge of someone coming with a very simple request. Hey, I want to get some money for someone's offering money. How should I take it? Turning into a realization that someone's trying to take over a neighborhood and really use that community's marginalization to further marginalize them is part of the work of understanding how racial equity advocacy is really important. I think Kip has
Can I just add one other thing? Throughout, we made the natural gas company pay for bus tours of other areas, and were able to leverage power to that community so that they were calling the shots and other people were paying for them. And they did that in a very, very righteous way, demanding equity on their behalf.
Thank you, Bill. Kip, can you unmute yourself and share a different kind of story about the tools that we will come to in a moment? We're giving you sort of the settings first, and then we'll come back and talk about how the tools are used. Go ahead.
Sure. Thanks, Camille. So I want to talk about Kerwin's interaction with the Franklin County Restorative Justice Circles and cultural humility a little bit. So basically, setting the scene, the Restorative Justice Circles are a local group of people working within the Franklin County Juvenile Court system and local volunteers tasked with creating plans for youth offenders that are restorative in nature. So they're tasked with getting youth offenders, Franklin County Juvenile Court system people, and community members and victims together to come up with a plan for young offenders that is restorative in nature, rather than the usual sort of court mandated punishments that usually do not do very good for the children. So the Restorative Justice Circles has been operating within Columbus, trying to do that for youth offenders within the system for a couple of years, but realized that they had kind of a problem. And their problem was that the court system and restorative justice circles had a problem with implicit bias towards Black and brown children, that plans were less readily made and less readily accepted for offenders of color. And of course, at Kerwin, we know that in the criminal justice system, largely this is a pattern that follows throughout the country, that Black and brown children are less apt to receive restorative justice or alternative justice treatments are more likely to be sent to prison for minor offenses. And so we really want to help out with this. So through our partnership with United Way, we started to give a presentation based off of principles of cultural humility, implicit bias, debiasing, and our own civic engagement principles that really sort of wanted to help the Restorative Justice Circle create a rubric within their organization to become more culturally humble and to help debias their systems in general. So we started out giving a 1-hour presentation to new and incoming volunteers. Ended up working with people who were already in the circle from Franklin County Juvenile System, from the community, and from their sources to basically do 3 things, in a sense, to change the way they thought about their interactions with youth offenders from one of simple service delivery to one of shared learning. So shared learning about culture, shared learning about situatedness, shared learning about inequality, to changing the norms of their organizations, of the Franklin County Juvenile System, of the RJC itself, to allow for that kind of learning, and finally to create a system that would allow for them to recognize power dynamics that are inherent in the juvenile justice system in general, knowing that, for instance, when a young child of color comes into contact with that system, they are less likely to feel comfortable being honest about themselves, less likely to be forthcoming because they understand that every move can be disastrous. And so that entailed a series of presentations over a year that we do with the Restorative Justice Circle to sort of instill those programs into their personal and professional practices. And after 3 years, Restorative Justice Circle now has their own rubric for cultural humility based off of those trainings that have helped them change their relationships both with the court system themselves and youth offenders who are coming in for restorative justice remedies.
Thank you, Kit. That's very helpful. And what I want to do is talk with you all, have a conversation with you all about how you sort of approached the issues. I'm getting a little feedback, but how you approach those issues as they came to you, and what parts of a racial equity approach or a racial equity framework you apply. And I'm working on volume. I'm not sure. I'll try to shout. Maybe my voice is way too low for some reason, so I'm going to do my best to keep that volume high. So some conceptual frameworks that are important in understanding and applying a racial equity frame include understanding social cognition and implicit bias, learning how to think about systems and how systems reinforce the status quo, and client-centered empowerment, self-empowerment, and rebellious lawyering. And because I think 2 of us are on the call are lawyers, I will tell you that lawyers both seek to be of service and also tend to dominate and take over things. And so we just the concept of rebellious lawyering and client-centered empowerment is about supporting the work in a way that is led by community. We're not the only ones that do that. Often we folks offer help when it's really partnership or listening that's needed. That's a little on rebellious lawyering. Systems thinking, I like to think of that as when you are trying to penetrate a group of people having a really interesting conversation, step into that conversation. And then once you move around, then they leave, they regroup, reestablish on the other side of the room and continue their conversation. There's a system that doesn't want to be changed, and you have to figure out the right intervention to either be a part of that conversation or change the conversation to the one that you want to lead. And on understanding social cognition and implicit bias, there's there was a slide I don't see, but it's essentially how many of you have heard about implicit bias or haven't heard? Give me like a little sense of folks understanding. Sounds like Ryan has heard of it. Some have heard a bit. I'll say briefly, I like to say implicit association. There's something called Project Implicit and the Implicit Association Test. And the idea is not that we are, bad people, or not that any of us harbor hate in our hearts. Some people do, but most of us have a preference that we don't even realize, an unconscious preference to be around things that are like us, or to respond to the things that are familiar for us. And so understanding social cognition, how people make positive associations and negative associations, is an important part of moving the needle on who gets resources who gets investment and who gets imprisonment, essentially. So that's all I'll say about social cognition at the moment. The skills are around reconceptualizing racism, exposing racialized structures, and storytelling and data. And so for these, I'm going to ask Kip and or Bill to volunteer an example from the story they just told you about any of these skills.
Well, I'll go ahead and go first. And the first one that I would probably talk about in terms of our work with the restorative justice circles would be, of course, mindfulness and sort of reconstructing, using mindfulness as a tool to change the way we think about race and racism and implicit bias in our lives from the circle. Part of the training that we did with them was a debiasing training. And the first and foremost part of that debiasing training, by way of the cultural humility training, was lifelong learning and learning how to ready ourselves to learn from every interaction that we have with people who are different than us. So how to change that from a situation where under cultural competence, I might feel like I need to know everything about this, say, Latino patient or Latino person that I'm working with beforehand in order to interact with them. How do I change the way I think about the way I learn, the way I approach the situation, to see this as a learning process from them? Maybe instead of feeling like I have to have all of the information in front of me, I can take this time to use this interaction, not only as a time to bring service, but to learn. And to do that, we have to be mindful of what keeps us from learning in those circumstances. We have to be mindful of the associations that we make with certain people in certain contexts, and how that stops us from learning and maybe causes us to think that we don't have anything to learn from these people that we're working with. So this also works in the power dynamics as well. If we're the restorative justice circle was working with children from really hard living circumstances that were usually used to being seen as people who didn't have much to offer. And as long as we were operating solely on that bias, it sort of short-circuited that ability to see that in that child and maybe come up with a helpful solution as far as restorative justice. So that involved a lot of mindfulness during the interaction, mindfulness before the interaction about our biases, were how it felt when a bias was present. So things like, talking faster, or lots of ums and ahs, kind of like I'm doing right now. Lots of verbal tics may be a sign to look for when a bias is present. And so we practiced looking for that. We practiced looking for that amongst one another. We practiced how we would practice that in the field, and that became part of our rubric.
Thank you. That's very helpful. I can imagine that that would be useful in some in context in the domestic violence and sexual assault world, either at the agency level or in other interventions that are systemic, and actually even in the individual service context.
Mm-hmm.
And I'm wondering if folks have thoughts, if you can chat whether or not you use mindfulness, awareness of implicit bias, or reconceptualizing racism in your current work. And for those who are lawyers, you can from your perspective. I don't have a sense of the other folks on the call, but I'd love to hear what I think we'd like to see how this is relevant to you in your work, to the extent that you are using it. If you're not, that's fine too. Bill.
Yeah, I wanted to take a moment, if I could, and address this issue of reconceptualizing racism. When we've worked with the Avondale Glen Elder Neighborhood Association and with other groups in the community, I think that it's important. It was important to list many manifestations of racism. We tend as a nation, we tend as a group to default to the understanding of racism as a manifestation of hate. Certainly that exists. That's one manifestation of racism. But racism also manifests in terms of our structures that continually turn out disparate outcomes, even though we may not be able to locate or find a racist in charge. So we have to understand racism as hate, racism as culture. We need to understand racism as implicit bias. And that includes not only bias against people viewed as outgroups or the other, it includes favoritism extended to groups that are in groups. And this manifestation of racism has a different approach to remediate. We need to understand racism as culture. So sometimes it is the culture that continually forecloses options that offer inclusion. And so the way to address racism as culture is different than the way you would address it as structure. And then finally, of the 5 levels of racism, we need to understand, again, racism does exist as hate. It does exist as structures. It does exist as implicit bias, in-group favoritism, out-group animus. It exists as culture, but it also exists as those who would manipulate race to create power and money. So when we sat down with the groups with the Avondale Glen Elder Neighborhood Association, we listened to their stories and we asked them to help us to understand whether the narratives, the history of that neighborhood fit into any of these categories. And we found out that it did fit into all of them. But we were then able to articulate the narrative of the community and their experience of racism as it related to structure, culture, implicit bias, hatred, and those who would manipulate that. So it's important to reconceptualize, because your remedy ultimately is affected by how you conceive of racism and its manifestations. So it's a very important tool. And again, of the 3 items that you have there, I don't know if you want me to address any of the other 2.
Well, what I'll do, I started off by talking about concepts and skills, and the other piece is tools. And you started to talk about the tools, so I'm moving the slides that way. But the tool of mindfulness, and I think if you could talk about the community narrative, or the racial impact statement, to give folks a sense of how that played out in one of your groups. But also I want to check in. I put in a question into the chat, and so I want to make sure that folks are with us. Or if you have specific questions about what you've heard so far, why don't you put them in the chat? Because again, we're talking across discipline, and what we're saying may make sense in our world, but maybe not in yours. So give me a sense of where folks are in the chat if you can.
And it might be helpful if you know structures such as the courts, such as the financial institutions, such as city government, such as landlords, housing. All of these can be looked at as structures, or they can be looked at as individual actions. And I think that it is important when we look at survivors and the systems that in which their lives unfold, we really need to understand, once again, in order to target and achieve remedy, we need to understand how the financial system conspires to make survivors have a viable life.
Right. No, that's very helpful. So why don't we talk about some of the other tools? Kip talked about mindfulness. And I think you both, debiasing is also a concept that's related to that, really looking for the ways where you can interrupt how a system is reinforcing a particular outcome. Can you talk about framing? Or rather, we could actually apply this to a DV setting so that we can get more into where folks are in the room. I'm looking at one of the chats for my organization. Our clients are navigating the civil justice system to obtain divorce custody from abusers. It can be difficult when primarily white judges are making decisions about families from backgrounds and cultures they may not understand. Yeah, a little bit about framing, I think, would be.
So framing actually, just by way of a little bit of background, since 2002, as a civil rights attorney, I have been meeting with cognitive scientists to find out how the brain processes information, because we need to show why some people are excluded, why some people are not. We need to be able to show when things are intended. And so as a result of those meetings, we have learned a lot about brain science. Now, framing is an attempt to invade those milliseconds between the time someone hears our message to the time they understand it. We can in fact craft a message so that people will respond empathetically, or they'll respond as if the person is non-human. We can craft a frame to basically trigger different responses by having an awareness of how the brain processes, associates, and ultimately understands and reacts to information. So framing is really a cognitive attempt to change. Now, we've applied framing in the court session in juvenile court. So we've got a justice system narrative, and I know that Kip's done the same thing. Mm-hmm. And part of the intervention there is to frame, what are we doing here? As a judge, what are you doing? And we changed the frame from the equality frame to the equity frame. And we have used maps, and this is something that Kip does, but say that at the time a judge issues an order, and we sit down with the judge and we show, at the time you issue an order, you can tell pretty much by where the person lives, whether they will be able to comply with that order. Because whether they have transportation, whether they have access to jobs, whether they have access to education, you can tell that by where they live. It's geographic. Opportunity is geographic. So by changing the frame of the judges from dealing with people equally to dealing with outcomes and measuring the outcomes and creating feedback loops, we change the frame, we trigger a different cognitive process, and begin to close those gaps. So because race plays a part in survivors' lives, I think that that creating a frame that changes the task of the judge from equality to equity is something that that is absolutely essential. And it has its roots in cognitive science. We need to change the way people process information in their brain. And luckily, it's not actually too difficult. I know Kip has examples, and his example, I think, addressed the same thing in juvenile court.
Mhm.
Right. I'll come to your example, Kip. Here, I want to just reflect a couple of the chats. Ones that justice system narratives differ according to race. If you're a young Black woman, you're a runaway. If you're a young white woman, you've been abducted. And that women of color are seen as aggressive in the DV situation and more likely to be arrested along with the perpetrator. Another one is that there's a spoken expectation by legal and community service providers that abusive women will occur in some communities because their religion and their culture doesn't, quote unquote, value women, in reference to East African immigrants who are primarily Muslim and in reference to Central American immigrants.
Mhm.
So, Kip, if you wanted to add to either that framing or narrative piece or whatever
Yeah.
strike you.
Yeah. I certainly think that, in our work with the restorative justice circles, a large part of what we did was reframing the conversation around restorative justice and who do we have it for. And a large part of that reframing also hits on this issue of transformational community narrative, which we'll talk about a little bit later. But we changed the frame of the conversation by changing who was in the conversation. So a big part of the training that we did with the Restorative Justice Circle was also about what do we want the Restorative Justice Circle to be and the work of restorative justice to be. Do we want it just to be, okay, we're going to take these kids and we're going to give them some alternatives and we're going to see them on their way? Or can the Restorative Justice Circle be a place where these young people are a part of what that restorative justice looks like? They're part of that conversation. So when we were thinking about that, it reframed the Restorative Justice Circle as sort of this organization that was advising the Franklin County juvenile court system as an outside thing to being a place where people trying to get justice through the juvenile justice system, people who were in the juvenile justice system, community members, and the justice system themselves, we're now coming together in a different way, changing those power dynamics in order to have a different narrative about who these children were coming through the system, what their backgrounds were, what that meant, and how did we know that on a more even plane. So in reframing the conversation in the Restorative Justice Circle, we really had to start by, in a sense, changing the table that we were having the conversation on to give everybody a more equal voice. And so reframing is something we do in terms of reframing what we're doing here, but reframing how we're doing it also helps transform that community narrative into something that's structurally different and gives us different outcomes and different power relations for creating those outcomes.
Great. Thank you, Kip. I want to pose a scenario in the domestic violence and sexual assault context, and perhaps use this as another way to explore the applicability of some of the racial equity concepts, skills, and tools to a situation that's familiar to probably many people on the call. Recognizing that some of you will be from legal services organizations, some of you will be from from a social work background or work at a shelter. There are, I'll just say, a TANF recipient loses benefits because she missed a meeting and with her caseworker when her child got sick. And despite letting the caseworker know that she is a survivor, but despite letting the caseworker know, she is a survivor and the caseworker knows this, but she's never been offered any supportive services, much less a waiver. We're talking about this in the context of our racial equity presentation. What would you, participants, do in this situation? Where would you start to begin a a racial equity analysis and some actions toward looking at systemic work?
So the difficulty here is that for the and what I'm sure that everyone on the call would probably do is address the needs of this individual client. But this is a structural issue that repeats. And therefore, the question ultimately is, and by the way, you probably have the data, and if you're not keeping data on the racialized outcomes of the people you serve, you should start doing that. So having some experience in dealing with the welfare structure and the racialized outcomes in the welfare structure, it starts with gathering that data to show that, in fact, there are racialized outcomes, that people based upon their race, ethnicity, even religion at some times are treated differently because of implicit assumptions that are there. I would start this by creating what we call a racial impact statement. And a racial impact statement starts with data to show that the outcomes are racialized. It's generally not difficult to show, even using the welfare department's own information, to show that people are treated different along racial lines. The question then becomes, how do we engage, how do we use that data to make a case to go forward? And this is where the importance of narrative comes. You know, often the dominant narrative, which is exclusive and oppressive, is that, you know, America is rugged individuals and they operate on self-determination. But this dominant narrative is incomplete, and it tends to exclude and tends to oppress people who don't fit that. So in the narrative, we don't take the data forward without expanding the narrative. And that means we have to have a genuine and authentic stories from the survivors themselves to talk about how they experienced the court, how they experienced the welfare system, and how they were treated and what their expectation was. So the racial impact statement begins with a narrative woven in data to link these disparate outcomes to racial, or to show that the current policy is leading to racialized outcomes, and then to talk about what it will take to change that. The remedy generally is intervention through debiasing and understanding of implicit bias.
And I'm sorry, there are a couple of questions about data, and because there's a lot here. So where does this data come from? What specific data are you looking for? And how do you begin to even get to know where to look?
So I would start with your own data in your program. And really, you cannot overlook that. You see people every day that are coming through your system, and perhaps you're not asking the right questions, and perhaps you need to make sure that at intake you're keeping track of race, religion, ethnicity, and keying that to outcomes, because your own data is sometimes going to be the most powerful. And you can begin to weave that story around the data too. But welfare departments, in fact, are required to report to the federal government lots of data, which actually until this administration was generally available. I'm assuming that it is, but I just can't tell for how long. So again, this is where you can use some some shared learning or community participatory research to gather that data. And I can point to sources. There's an equity atlas that exists, which is one source of that data that can be localized by county.
Right. And Bill, what I would also say is, depending on where you are, you may not be the person that needs to get the data.
That's right.
You may actually want to expand your set of stakeholders and partner with someone else who knows a lot about data. And I know, Kip, you've had some experiences with that. Can you comment?
Yeah, so we are usually a data provider partner. We are usually the data partner for communities of color in the Central Ohio area and across the nation about just these issues. We are able to collect data from the census, from other sources. We're able to, at times, go out and collect data locally or create collaborations between local partners to collect data, both qualitative and quantitative. And so my comment would be, we're looking for partnerships to collect data. Local universities are usually the first on that list, especially land-grant universities that have a standing commitment and a standing requirement to do community work. Whether you're a land-grant college like the Ohio State University here, a certain amount of your funds, a certain amount of your energies must be spent within the surrounding community. So that is a partner that is by law required to help gather data. And usually that's through institutes or colleges like College of Social Work, the College of Public Health, usually are good sources for that kind of data and that kind of analysis.
No, thank you. And how do you, how do you get to the point where you are, you're thinking about this from moving from an individual standpoint to a system standpoint? I'm thinking about this question. The TANF recipient loses benefits because she misses meeting her caseworker, and she's not getting services. You want to help that one person, but how do you move from there to really looking at what you can do to change the system?
Yeah, I think, I was looking at the question, and it's all, when I think about where do you start, it's almost like you're starting in two different directions, right? You're starting on a very personal, localized solution for this particular client, which would probably include some sort of advocacy with TANF around remedying this particular situation, maybe finding alternative remedies to get that client's needs met right now. But also could include things like transformative narrative. When you are in this situation, a lot of times you can feel quite alone. And I think we don't think about the effect that has on our individual clients, about, aloneness and the sort of will to go on, the will to look for some of these other situations. So creating a community of care, maybe amongst people who have been involved in this, can be a part of that, of that particular scenario. But in terms of going to a structural and an institutional standpoint, we usually have, when we work with community organizations and advocates, and we are very high on creating what we like to call collaborations of care amongst other people involved in service delivery, with that particular client. So somebody seeking TANF benefits may also be involved in the community housing or local affordable housing arrangements, may also be involved in programs like children with programs and programs like Head Start, after school lunch programs. They also might be enmeshed in other community systems where there are people looking to better their services as well. And so under a frame of creating better services for these clients, this may be a chance to reach out to maybe if they're living in affordable housing to do that, or if they're dealing with issues of domestic violence, maybe a court or a shelter, reaching out to those other partners to create pathways to really take on systems. So maybe taking on TANF as an individual may not be a good idea, but certainly taking on a wealth of different organizations in the community by coming together and creating new solutions, maybe with people from the health department and or people from the local church, creates a lot of different ways to think about those, how those systems are impacting people, a lot of different touch points for people in these systems, and a lot of different ways to come at people, come at organizations like TANF, like the state, like city worker, like city services.
Right. No. And Bill, I know you have some experience in this area too, really getting people to, well, one, say, I want to acknowledge that there are folks in the domestic violence and sexual assault community who are doing systemic work and who uh, uh, have multiple approaches to getting there. And I think this piece of actually connecting the dots between, where you are and the other folks who are having similar experiences and the other advocates who are dealing with these issues is a way to bring together, get people on the same page, and then come up with strategies that are more holistic to address the issues that your one client is facing. But please go ahead, Bill.
Oh,
Well, I wanted to just raise two things based upon the discussion. One I'll just deal with briefly, and that is when you're dealing with an individual client, you provide for them a framework in which to better understand, and in fact, to ratify and confirm the fact that they are victims of racialized systems. That has a tremendous healing effect. The social psychologists with whom I've worked the last 15 years have told us that even if for the individual, just to ratify the fact that there are racialized outcomes, excuse me, that you can, in fact, people internalize oppression. Survivors often internalize oppression. If you can offer an individual a door, a window to show how that oppression, in fact, is real, and in fact, it takes many forms, they begin to see a path forward. So even for the individual, providing that is helpful. The second is we've worked with the State Department of Housing, Health and Human Services. Because of racialized outcomes in the treatment of people in the TANF program in California, that's called Calworks, the racialized outcomes were established by data. Ultimately, we engaged the Department of Health and Human Services and the Department of Human Services to institute data loops for each frontline worker. So they have on a monthly basis some data that comes back to each of them to tell them about the outcomes of their interactions with people in the system. They're about to launch a training where they require everyone on the front lines of the Calworks system to take implicit association tests, the IATs, to understand where their bias lies, to understand how they might treat people differently, and then to monitor that. So we started actually with the individual cases. We started with the data that showed the disparate outcomes, but then worked all the way up to the state level and have been working the last 4 years on a project that will launch to bring implicit bias, de-biasing to the front lines of legal services. We're finding that the problem from the state is that some counties welcome this, some counties do not, and it becomes an enforcement issue for them.
Right, and Bill, you mean bringing implicit bias to the front lines of the agencies?
Of the agencies.
Yeah,
the agencies. In this case, if we take the survivor situation, we know that they're treated differently, and it might be because of implicit bias of in this case the TANF worker. So what we have to do is try and de-bias that. That's a long-term goal, but we've taken several steps down that goal, that pathway, and at each step taken the survivors with us to explain their interaction, to expand the narrative to be more inclusive rather than the dominant white narrative about how America works.
No, thank you for that. I think the point you make is a very good one. Going back to sort of these tools, that it's a multi-layered process, and there's a question of when and where you enter as an advocate, as a survivor, as a partner. I know that our advocacy partners often share these kinds of insights in multiple ways. They try to hold that space for survivors about the injustices they experience, and then utilize that energy and that shared narrative to expand the narrative to promote their advocacy goals, whether those goals be shifting a system and an agency's systems and practices and policies, or whether it be shifting the conversation about what's important for the sector.
I was wondering if there was time for me to add on something else about building community partnerships.
Oh, absolutely, please.
Yes.
I just wanted to, also reiterate looking at local universities and local institutions as taking the lead on that convening relationship. So building a relationship with community partners, particularly institutions like universities, hospitals, are often, have a lot to gain in terms of creating better equity and more equitable solutions in communities, and often have a lot of resources for convening a lot of different partners from around the city into partnerships. So in another project that we're doing, for instance, around affordable housing, which is sort of outside this world, but I think is very important, both the hospital, a local church, the local United Way, and of course Ohio State have all acted as convening partners for community members who would often not get a say in how affordable housing gets built in their communities and how housing gets built in their communities. And so the agencies, and particularly the grassroots organizations that are representing these people, usually wouldn't have the kind of resources. I mean, it's hard when you're trying to help individual people out on a regular basis to then have that capacity to sort of build tables and convene tables and get people together. Institutional partners often have the sort of skin in the game in terms of wanting to create better solutions for the community in general, and also the organizational and resources to pull a lot of people in. So creating relationships with those institutions, particularly hospitals, particularly universities, particularly local United Ways, and larger churches with a community orientation and focus can help sort of take the load off of your shoulders in terms of where do I start, and having a partner to start along that larger structural conversation as well.
Right. No, thank you. I want to check back in also to see where folks on the call are at, and ask about sort of specific questions or concern. We're coming up on our last 5 minutes, and we've talked about a lot of different things. To recap, there's the why of this is to better understand how to do the work that we are trying to do, both in terms of being effective service providers and advocates through all the racial schema that are around us, as well as identifying systemic issues and how to change those systems so that they work for everyone, not just work in the way that they've always worked. Not because anyone is a bad actor, but because we are all influenced by the structures around us, the institutions, the way those institutions relate to one another, the schools, the houses, the culture reflected on television. How do we work against that? It seems like it's too much, but it actually is something that can be addressed with education, investing time and energy in developing understanding of mindfulness strategies, skills of reconceptualizing racism, and working with others. Most importantly, building common cause with those who are affected by these issues. As we're closer to time, I'm going to move forward to the wrap up, but also give people an opportunity to ask any questions or to share any situations that they are faced with. Moving from working on individual cases to thinking systemically is often challenging. Or, I mean, some people are doing on this call, I'm sure, are doing it. But making the connections with resources in your community so that when those opportunities come up, you can bring your folks and your issues to the table is an important part of the work. So if they're not questions, I will turn it to Sarah or Lisa Lynn to do questions, to do the resources and announcements. I'm not sure who the next person will be, but there we go.
I think that's me.
Oh, great. Hello.
Hi, I'm Erica Sussman, and I'm the director of the Center for Survivor Agency and Justice. And I do welcome folks to send in questions as I'm talking and sharing some of this with you. So, and I want to, first of all, thank you so much, Camille and Lisa Lynn and Kip and Bill, for sharing your rich perspectives and powerful strategies with us today. As Camille had said at the outset, this initiative, this REAP initiative, is about collaborative and cross-movement work. And as Lisa Lynn had articulated, this work really couldn't be done without the powerful partners that we have with us today and who will also be joining us in subsequent webinars. Their presence, their critical thinking, their willingness to dig deep with us is really integral to our learning on this project. And so I'm deeply grateful to them. And also deeply grateful to all of you who have joined us today, because you are part of this learning process with us. So thank you very much. To speak directly to the resources that we have, Bill had mentioned before, he provided a little bit of a taste of a critique of rugged individualism in the context of public benefits. And of course, that critique applies to many of the institutions that serve as gatekeepers to the critical resources that survivors need to be safe. And that leads me to sharing a new resource that CSAJ just released, which is our Atlas on accounting for economic security. It's intended to be for direct service providers. And this is the first map book in a series of map books that will follow. This one just released, is on our website and accessible, and really is an attempt to gather up a lot of research related to the intersection between economics, safety, and social inequality. So I urge you to take a peek at it if you can. Here are some other core resources from CSAJ's work that might also be somewhat helpful depending on where you sit. The first is CSAJ's National Needs Assessment Report that came out in 2012 based on our work with advocates and lawyers across the country related to economic justice work. The second is a piece on the economic ripple effect of domestic and sexual violence. The third is our Building Partnerships for Economic Justice report that relates to some of the work we've done with pilot sites across the country. And then the last one listed here is Building Partnerships. It's a self-assessment tool for organizations and communities that are interested in doing some self-reflection and better situating themselves to engage in economic work with and on behalf of domestic and sexual assault survivors. So those are a handful, and there are many, many more in CSAJ's resource library. There's a link to that here, but you can also navigate your way there through our website. So upcoming webinars. So Lisa Lynn had referred at the outset to the fact that this is one of many. You can find our webinars in our library archives at this link listed right here. Our next webinar is taking place on May 25th and will it focuses on race equity approaches from a community and advocacy perspective, and we'll be featuring some of our other partners in this work who will share the amazing advocacy initiatives and community organizing and deep thinking that they've been doing in this realm. So I urge you to join us, and the other ones are listed here as well, and will follow in every other month after that.
And just to interject quickly, Erica, there have been some questions throughout the webinar today about accessing the PowerPoint in today's webinar, and all of that will be on our website at csa.org/webinars, as well as our resource library. And if you registered for the webinar, you'll receive a direct email from us with all of those materials. So we will send both the PowerPoint and the recording and any supplemental resources that were mentioned today. So just wanted to flag that for you all.
Great, as well as an opportunity for folks to give us your feedback on today's session. We really welcome that, and we'll use it to inform our next steps.
Yes, you'll be directed to an evaluation page when we close down today. So I really encourage you to ask more questions, give us your feedback, let us know how we can be helpful in following up on this webinar and what else is happening in your world as you do this work.
Great. And if I may, there's questions. I think the questions started to come as we were closing out, and I just want to acknowledge this one, that the question was that the person would have a difficulty telling a person that they were victims of racism, and telling the client their own experiences. What are ways we can advocate through the lens of acknowledging this systemic violence without conversations throughout hierarchy? Camille, you had mentioned those power dynamics a while back between advocates and clients. And it's an excellent question, and I think Bill affirmed that we don't tell people that they're victims of violence. We provide the frame. Kip shared that at Kirwan they let the picture paint itself, starting off with a frame of fairness, and then letting people know that they haven't been treated fairly by the system, and that changes can be made. And then they talk about how to go about making those changes, using multiple strategies. And when you have the mapping and the storytelling, the fact that it's racially motivated usually reveals itself. So I think there are probably other questions. I hope people will submit those after the fact or going forward. But thank you much, and I will turn it back to Erica.
Thank you, Camille, and thank you, everybody. I don't have anything further. Sarah, are there additional pieces that you want to acknowledge, or Lisa, Lynn, anything else that you want to contribute?
Just to echo your thanks, Sarah, and Erica, my apologies, and to let people know, to the extent that they're still on the call, that there's a rich discussion going on these issues in the chat box, because some people have raised some of these issues. Mm-hmm. And, I'd just like to reflect in closing on something that Bill said that really struck me, which is, I'm going to characterize it differently than he said it, but it also gets at the question that Camille was just responding to about how you engage with a client who is dealing with some of these issues. Do not underestimate ever the power that you have to support and help heal your client in your literal ability to see them. I was talking to a friend of mine quite recently who worked for the Obama administration, who was expressing some frustration around a variety of issues and where they are at the moment. And I said to her, you cannot take back from the universe of folks that you worked with what it meant for them and to them to see, for you to see them, for the administration to see them. And that has such tremendous healing power, and is such a skill and an ability that each of you brings to this work that you do every day. So I just want to close by thanking you all for being in the work and in the struggle and continuing to do this work in the many powerful and healing ways that you do it.
Thank you all.
Thank you. Thank you.